Ever get a nosebleed that just won't stop? Or maybe you bruise super easily, like even the slightest bump leaves a mark?
Oh, yeah.
Yeah.
I know what you mean.
These could be signs of something more than just clumsiness. We're diving deep today into von Willebrand disease. It's the most common inherited bleeding disorder, but a lot of people haven't even heard of it. It affects maybe 1% of the population. So, chances are you probably know someone living with it.
Right, and they might not even know it.
Exactly. So get ready to, unravel the mysteries of blood and bleeding, because today we're going way beyond the headlines and getting into the nitty-gritty of VWD.
The real deep dive.
Yes. But first, let's rewind the clock, like all the way back to 1926.
Okay.
Picture the Åland Islands in Finland. It's remote, windswept,
I can picture it.
and there's this physician named Eric Adolf von Willebrand, and he encounters this family that is dealing with a very peculiar bleeding disorder,
Oh.
especially the women, yeah. They had heavy periods, frequent nosebleeds. It was a real medical mystery at the time.
Huh. It's interesting, because back then, our understanding of blood clotting was still pretty basic.
Yeah.
Hemophilia was the main focus, and that was mostly linked to, deficiencies in factor VIII or
Yes,
IX.
right.
But this new disorder, it was like a puzzle that stumped researchers for years.
Like they had all the puzzle pieces but couldn't figure out how they fit together.
Yeah.
Patients were experiencing bleeding, but the clotting time seemed totally normal.
Yeah, especially with the limited tests they had back then.
Exactly. So decades of research finally revealed the missing piece.
Okay.
Von Willebrand factor.
VWF.
Yeah, or VWF. Now think of VWF as like the stage manager in a huge theatrical production.
Yeah.
It's setting the stage for blood clotting. Its primary role is to help platelets stick to a wound site
Got it.
and then form a clot. It's essentially plugging the leak.
So if the platelets are the stars, the VWF is making sure they hit their marks.
Exactly.
Right.
It's the glue that holds everything together. And this is where it gets interesting. It's also connected to hemophilia. VWF also protects factor VIII
Oh.
from breaking down too quickly.
So if the VWF isn't working correctly, then factor VIII levels could be affected too.
Yeah.
That's interesting.
And that makes it really hard to differentiate between VWD and mild hemophilia.
It kind of blurs the lines.
It does. So VWF is a multitasker. But there's not just one type of VWD, right? We
Yeah.
have types 1, 2, and 3, and even subtypes within type 2.
Yeah, it's a big family.
The whole family reunion.
It is. And this is where understanding the quality versus quantity of VWF becomes important.
Okay.
So imagine you have a rope. Type 1 VWD is like having a rope that's too short.
Uh-huh.
It's still there, but it might not be as effective.
Okay.
Type 3, on the other hand, is like having no rope at all.
Oh, wow.
Yeah.
So no help.
Exactly. And then type 2, with all its subtypes, is where it gets really complicated.
Okay, the tricky one.
Yeah, type 2 is like having a rope with knots or like frayed sections.
So it's there, but not really working the way it should.
Right, it might be there, but it's not functioning properly.
Okay, so with all these variations, how does this actually play out in everyday life? What should people be looking out for?
Well, a lot of the symptoms involve, noticeable bleeding,
Oh,
frequent nosebleeds, especially in childhood.
Yeah.
Easy bruising, cuts that bleed a lot. Those are some common signs.
and what about women's health? Heavy periods can be a sign too, right?
Absolutely. Heavy menstrual bleeding or menorrhagia can definitely be a red flag.
So many things to be aware of.
But here's the thing. A lot of people go undiagnosed for years, sometimes even decades,
Really?
especially those with milder cases. They might just think easy bruising or heavy periods are normal.
Wow, that's concerning.
It is. And that's why it's so important to recognize these symptoms,
Yeah.
and know when to actually seek medical advice.
But VWD can be tricky to diagnose.
Yeah.
How do doctors even begin to identify it?
It's like piecing together a puzzle. They have to
Okay.
look at a patient's bleeding history, family history, and then run specialized lab tests.
So it's not a quick and easy diagnosis.
It's not always straightforward because VWF levels can naturally fluctuate,
Oh, okay.
which can make diagnosis tricky.
So someone could have VWD but not know it until something major happens.
Exactly. Some people are only diagnosed after a significant bleeding event like surgery or childbirth.
So being proactive and advocating for your own health is really key,
It is.
especially if you notice any kind of unusual bleeding. But if VWF is so vital for clotting, why don't people with VWD bleed constantly?
That's a great question. Remember that rope analogy we talked about?
Yeah,
Even a frayed rope can still hold up under normal circumstances.
right.
But when there's extra strain, like an injury or surgery, that's when the weaknesses show up.
So it's like those small challenges are manageable for the clotting system, but major events can really expose the vulnerabilities of VWD.
Exactly. That's why understanding and managing VWD is so crucial.
So it's about being prepared.
Yes. It's
Well,
about being prepared and having the right tools to deal with those challenges.
it really is. And, that lack of awareness can really lead to some challenges, especially for women.
Yeah, definitely.
Dealing with, like, heavy periods every month, but
Mhm.
being told it's normal.
Right.
That's got to be tough.
It can be really debilitating, both physically and emotionally.
It's like a silent struggle in a way,
Yeah.
affecting so many parts of your life, but nobody can see it.
Exactly. And that's why it's so important to, raise awareness. We need to empower people to advocate for their health
Yeah,
and to actually seek help if something feels off.
absolutely.
Mm.
But diagnosis is just the first step, right?
Yeah.
What happens next? What can people do to manage and treat VWD?
That's the big question.
It is. We know it's complex, but is it manageable? Can people with VWD, live normal lives?
Well, the good news is that VWD is manageable. Treatment options have come a long way.
Yeah, okay.
And there are a lot of possibilities now that can be tailored to individual needs.
So there's hope.
Oh, definitely. It's not a life sentence of constant worry and limitations.
That's good to hear.
Oh,
But with all those variations we talked about earlier, how do doctors even figure out the best way to treat it?
it all starts with a really thorough assessment.
Yep.
They look at the type and severity of VWD, bleeding history, lifestyle, and personal preferences.
Okay.
And for some people, simple lifestyle changes might be all they need.
So like avoiding certain medications or being extra careful during physical activity.
Exactly.
Makes sense.
But for other people, medication might be necessary. And one option is desmopressin. It's also known as DDAVP.
Okay.
It basically stimulates your body to release its stored VWF.
So it's kind of like giving your system a boost when it needs it.
Exactly.
That's pretty cool.
Yeah, it can be a real game changer, especially for those with type 1 VWD.
Makes sense.
Yeah.
But what about the more severe cases or people who just don't respond well to DDAVP?
Well, in those situations, we have VWF concentrates.
Okay.
These medications directly replenish the missing VWF, which is a more targeted approach.
So they're basically replacing what's missing.
Right.
Okay.
And there have been some really amazing advancements in biotechnology recently.
Oh, really?
Yeah, there's something called recombinant VWF concentrates.
Recombinant. That sounds so futuristic.
It does, but it's real. These concentrates are made in a lab.
Oh, wow.
So there's no need for donor blood. And they're also much more pure and safer.
That's amazing.
It is.
So we've got medications that can boost or replace VWF. Are there other things people can do on a daily basis to help manage their VWD?
Absolutely. Supportive care plays a really vital role.
Okay.
For example, iron supplements can help with anemia caused by blood loss.
Right.
And physical therapy can actually strengthen joints and improve mobility.
So it's about taking a holistic approach,
It is.
addressing not just the bleeding itself, but all the potential side effects too.
Exactly. And of course, knowledge is power. The more you know about VWD, the better you can make decisions about your health.
It's about becoming your own advocate.
Right. It's about empowering people to be active participants in their own healthcare.
I love that. But there's another piece to this puzzle too.
Okay.
What about the emotional side of things? Living with a chronic condition like VWD has got to be tough.
It can be. Even if the physical symptoms aren't severe, there can be a big psychological burden.
Right?
The constant worry about bleeding, the fear of social stigma, how it impacts relationships, those are real struggles.
Yeah, absolutely.
And that's why access to psychological support is so important.
Okay.
Therapy, support groups, online forums, all of those can be incredibly helpful.
They can provide a safe space to connect with others who understand, right?
Exactly. It's about creating a sense of community and belonging, letting people know they're not alone.
And reminding them that VWD is just one part of their life.
It doesn't define who they are.
Exactly. But even with all the progress we've made, there's still so much we don't know about VWD.
There is. But that's the thing about science.
It's always evolving.
Yeah, it's a continuous journey of discovery. And thankfully, research is ongoing, so there are exciting developments on the horizon.
It really is exciting to see all the progress. But before we wrap up, let's go over some key takeaways. What do we really want our listeners to remember about VWD?
I think the most important thing is that VWD is way more common than most people think.
It is.
It affects something like 1% of the population.
Wow.
So chances are you probably know someone living with it, maybe even without knowing it.
It really highlights how important awareness and education are.
Absolutely. The more we can talk about VWD, the more likely people are to, recognize those signs early on.
And get diagnosed.
Exactly. Early diagnosis is so important,
Yeah.
not just for managing the symptoms,
Right?
but also to prevent any serious complications down the road.
We've also learned that VWD can be super complex.
It is.
All those types and subtypes.
Yeah, it can be tough.
Each one is kind of unique.
Right. That's why it's so crucial to work with a healthcare professional,
Yeah.
They can help figure out the best treatment plan for each individual.
And there are so many more treatment options now than there used to be.
There are. We have everything from lifestyle changes to medications that can boost or even replace VWF.
And even gene therapy might be a possibility in the future.
Exactly. The future is looking bright for VWD treatment.
It's good to know that there's hope out there,
Definitely.
that people with VWD can live full lives,
Absolutely. They can be active and do all the things they want to do,
especially with the right support.
and the right management strategies. And that support goes beyond just medicine. Oh, for sure. It's about emotional support, too.
Yeah.
Building a sense of community.
Making sure people don't feel alone.
Exactly. And empowering individuals to advocate for their own health.
It's about recognizing that, okay, VWD is a part of someone's life, but it doesn't define them. It doesn't limit what they can achieve.
Exactly. And as research continues, we're only going to see more targeted and effective therapies.
That's great.
Yeah, things are really looking up for people with VWD.
Well, that's a great note to end on.
It is.
We've covered so much today.
We have.
I think it's time to wrap up our deep dive into von Willebrand disease.
I agree.
We hope this has, shed some light on this condition that a lot of people don't know much about.
And we hope you feel empowered to learn more and advocate for yourself, or maybe someone you love who might be affected by VWD.
Absolutely. Knowledge is power, after all.
It is.
The more we understand about VWD, the better prepared we are.
Right. We can navigate this complex disorder and support those who are living with it.
If you're looking for more information, make sure to check out the show notes.
Yes. We'll have links to some great organizations and resources.
And most importantly, remember that you're not alone.
Absolutely not. There's a whole community out there.
Ready to offer support.
And help you through the tough times and celebrate the good times.
Thanks for joining us on this deep dive.
It was a pleasure.
Until next time, stay curious, everyone.